Good evening and welcome back. You're watching NDTV. I'm Rishika Barwa. Unlock 4.0 has been announced. This despite the sudden rise in new cases, the rising positivity rate and the R rate, which is the reproduction rate, which measures how infectious the virus is. Now, the last 3-4 days has indicated a turnaround from the earlier declining trend in terms of new cases, positivity rates and the R factor. Now, the latest COVID-19 trends over the last 10 days are worrying, to say the least. Not only at the all India level, but also 10 of the 20 bigger states in India are now showing signs of a second surge. Joining me this evening, Dr. Randeep Guleria, the head of the All India Institute of Medical Sciences. Thank you so much, Dr. Guleria, for being with us. We have lots of questions for you. Over 75,000 infections for 3 straight days. The highest rise in daily cases in the world since August the 4th. Is Unlock 4 really wise?
So the number of cases definitely are increasing, and we've been seeing that over the last few days. And what it really suggests is that we are seeing the pandemic in India spreading to different areas in the country and going to smaller towns and maybe part of rural India, which was not happening in the past. So there is a pan-India spread which has happened, and therefore there is a need to be very, very vigilant in terms of being able to make sure that we develop aggressive strategies of containment zone, of aggressive testing, of tracking and of treating and isolating individuals. At the same time, it's been almost 6 months, and I think there is also a huge strain, whether it be on the economy or whether it be on various other issues as far as the country is concerned. So a balance has to be struck. But I think we have to be very vigilant for 2 reasons. One is, like you rightly said, the number of cases have gone up. We are also testing more, so that could also be a relative factor. But also because we're moving into what we commonly call the festive season.
Yes.
And this would mean to more and more people sort of coming together because of the festive activities. And we need to be extra cautious during this time, because otherwise we will see an increase, further increase in the number of cases.
You're saying that come festive season, India could see a further increase. Well, my next question to you was, is this the coronavirus peak in India, or is the worst yet to come? It's interesting because on August the 12th, the Center for Molecular Biology had indicated that India has not yet reached any peak or even plateau in terms of COVID-19 cases. Has that changed from August the 12th?
So it's difficult to say. I think what decides is 2 factors. One is how the society and how individuals behave. We still have a large number of people who are prone to infection, as has been shown by the serosurveillance. And therefore, if we are not careful in terms of regularly wearing a mask, in terms of physical distancing, and in terms of hand washing, then the number of cases will continue to rise, and we will not be able to flatten the curve. There is a lot of community participation which is required, especially, like I said, when we move into the festive season, because people have to understand the responsibility and maybe realize that this time the festive season will have to be curtailed to some extent. It can't be like it was last year, because of the fact that if we really get together and start having all the festival activities as we did in the past, like Durga Puja or other things like we do during the Navratras, we will not be able to follow all the norms that we want.
Right.
There will be a higher chance of the spread of infection.
Do you then foresee the peak to happen in the festive season?
This is a difficult question. I hope that we are able to flatten the peak before flatten the curve before that, but it is a possibility.
Okay, it is definitely a possibility, and of course a lot of community participation is what you're stressing on. Is India at an early stage of a second wave? That's an insecurity among a lot of people, especially if you look at the trends over the last 10 days. They are worrying. In 10 of the 20 bigger states, there appear to be signs of a second surge.
So it's difficult to say whether we are going in for a second wave, or there's still a fluctuation as far as the first wave is concerned, and there was a downward trend, but now again things have come up.
Okay.
You could call it a second wave, or you could call it a fluctuation in the number of cases which had come down, but now because of a number of activities opening and people crowding, the cases have started to go up. So there is an increase in the number of cases in various cities where the cases had come down significantly, and that is something we need to address aggressively, so that we don't let this reach the level that it had when these areas had peaked.
Right. Dr. Guleria, a viewer sends us a question on metro services that are reopening now from the 7th of September. This is part of Unlock 4, of course. Is it safe to travel in a metro?
So again, if you are able to maintain physical distancing, if you are able to make sure that it's not as crowded as it was in the past, and we are sanitizing our hands regularly, the metro services can be run in a relatively restricted manner.
Okay.
Globally, if you look at data, even in Europe, a lot of metro services are now running, but again, they are following very strict norms in terms of number of people inside the metro, the type of physical distancing that is required between seats. We need to be very aggressive as far as following that is concerned. I hope we can do that and people really do it in a responsible manner.
All right. Unlock 4 also allows for 100 people to gather for social, political or religious reasons. Are gatherings of 100 people safe?
So the same thing is applicable there, that whatever gathering you do, you have to do it. I would say it should be more outdoor if possible,
right,
and in a bigger area so that there is less chances of people coming close together. My only fear is that, when you have such gatherings, there is usually something to eat or drink, and to do that, people will pull down their masks and then crowd close to each other, which itself is not a very advisable thing to do.
Okay, so perhaps rules and regulations need to govern these gatherings then, Dr. Guleria.
Yes, that's the point. Yeah.
Okay, so eating is of course one of those critical questions. Lowering your mask to eat, or some people lower their mask to even talk, is really not advisable. Let's just shift our focus to Delhi. Dr. Guleria, is Delhi seeing a second wave of infections? News just came of over 1900 new cases in the last 24 hours. This is the highest since the 10th of July.
I agree with that. So we have seen in Delhi for a long time our cases had been around 1,000 to 1,200, but now gradually they've started going up. And it's a cause of concern. I think we need to be very aggressive in our containment strategy, the testing strategy, which we had adopted last month, and we were able to significantly bring down the cases.
Yes.
But even in the hospitals, we're seeing a gradual rise in the number of admissions, which had come down significantly. For quite some time, we had a large number of vacant beds, but that situation is changing, and I think we need to have a very aggressive policy so that we don't reach a stage which we had about 6 weeks ago.
But would you say that this is a second wave, or would you again, err on the side of caution and call it a fluctuation in numbers?
So it depends on how you want to label it. You could theoretically argue that this could be a resurgence and maybe like a second wave or fluctuation. Right. I think the challenge is that we don't let these numbers rise and we work aggressively to start bringing them down.
Okay, because we've been talking about rising numbers, there's another raging issue in the country right now, which is whether it's safe to conduct exams in the midst of this pandemic, especially now when we're seeing a spike in cases. What would you like to tell the lakhs of students out there who are going to be appearing for the JEE and the NEET exams?
So I can give you our own example because we conducted our All India examination some time back.
That's right.
We were able to do it. We increased the number of centers. We worked on a strategy that there was physical distancing while people gave this exam online, and there was a lot of hand sanitization. It was no touch technique. You had to just show your identity card with the barcode, and it was scanned, and therefore there was no physical contact. And there was areas where if someone had been quarantined, he could sit separately and give the exam. So aggressive planning needs to be done. But the important issue here is that, you see, if we don't hold the exams, students will tend to lose an year. And this will have a huge impact on their academic career. And therefore, we need to balance out the two. Do the test, do the exam in a manner that it is safe because of the number of cases. At the same time, make sure that we don't cause a cluster of cases. But make the students' career should not suffer, because if they get clubbed to the next year batch, then you will have two batches together, which will create a huge chaos for not only the next year's batch, but for this year's batch also.
Any advice to students who are in far-flung areas, students who are going to have to take public transport or, live in hotels while they go to far-flung centers to write these exams? Any special extra precautions that they must take?
So I think students who are going for the exam should definitely have their mask on, carry their hand sanitizer, and maintain physical distancing. I think in most places the centers will be close by. They may not have to travel large distances. I hope that is the case.
Right.
Even if they do that, then they should maintain physical distance, and the examination centers should be such that they're close to their residents so that they could probably travel early in the morning, give the exam and come back by the evening itself.
All right. Are younger people, Dr. Guleria, more susceptible to COVID-19? The Delhi Sero survey indicated that the highest infections were among minors between the age of 5 to 17. The World Health Organization has now gone ahead and said that the pandemic is largely driven by those in their 20s, 30s and 40s.
So the younger people are the ones who are, for multiple reasons, getting more infection. One is the simple fact that they travel a lot, they go out a lot, they are less following the COVID appropriate behavior. So there is more infection in them, but there is less severe disease in them. So if you are having a severe infection at an older age group, you would actually stay at home, you would be admitted because you have symptoms. But the younger age group people have mild or no symptoms. That is why they tend to get the infection more and they meet their friends, and therefore the number of cases become much more, because either they have very mild flu-like symptoms or they have no symptoms, and many of them don't even get them tested, and that's why they were never tested but came out to be positive in the serosurveillance.
Right. So what you're essentially saying is this has more to do with not following social distancing or wearing masks or mingling with friends than it does to do with some kind of a genetic disposition of being younger and more susceptible.
Correct.
Okay. Dr. Guleria, chances of reinfection of COVID-19, this has been, in the news. There are globally now documented cases of reinfection that are being reported. How worrying is this?
So it will always be a cause of concern because it has multiple implications. I think currently the number of cases that have reinfection is very few, because initially there was also the scare, but it was shown that there were some individuals who had an ongoing infection and the RT-PCR test in between had become negative, but they were still shedding the virus, and subsequently it was positive and it was labeled as reinfection.
Right.
However, there have been cases where people have done the gene studies and shown that it's a different viral strain, and therefore it is a reinfection. So we are seeing a few cases of reinfection. It's still very minute, not a major problem. But my concern is that this is the early days. As the pandemic advances and we have more and more cases and the immunity starts waning in some individuals, they will be predisposed to reinfection, and we may see this subsequently in subsequent months. And that is a cause of concern, because if you remember, we had this has been shown in some studies that some individuals who have very mild infection form very low antibodies in their blood, which was followed up when they were being evaluated to give their plasma as convalescent plasma.
Right.
And therefore, it's likely that many individuals who have very mild illness had very little antibodies, which waned after a few months, and they were again susceptible to the infection because their immunity was not that strong as far as subsequent infection is concerned. How big that percentage is doesn't seem to be very big. It seems to be a small number. But like I said, it will be the next few months when we have a larger number of people who have reached a stage where the antibodies come down, that we will get an idea of how frequent is reinfection.
All right, but that's definitely something that, people need to guard themselves. Again, if you have recovered from the coronavirus, it doesn't necessarily mean that you're safe from reinfection. Another viewer has sent in a question on how long do the effects of chronic fatigue last in recovered patients, and this, I believe, has been sent to us by a viewer who's back to a full-time job.
So this is something that we're learning now, that we were initially focusing a lot on acute care as far as COVID is concerned. How do we treat these sick patients coming in? What are the treatment strategies, steroids, remdesivir, tocilizumab? Now we're moving into a phase where we're seeing a lot of recovered patients who have what we call post-COVID sequelae. And one of the most common things that we are seeing is this fatigue, body aches, not being able to go back to full work. And this sometimes lasts almost 6 to 8 weeks. But what is worrying is that we're also seeing a number of patients who have lung fibrosis, damage to the lung, they become breathless on minimal activity, and they have to undergo a regular physiotherapy or rehabilitation program to improve their lung function. So post-COVID sequelae, whether it be fatigue, body aches, lung fibrosis, or the poor function of the heart, low ejection fraction, are all now issues which are coming up. And for me, it's a concern as to what is going to happen in these individuals in the long term. So one is COVID, then the issue is recovering from COVID, but having some residue which will cause some problem to you months and years down the line, which we will also have to address so that these individuals are back to normal and are able to live a good quality of life.
And is our healthcare system focusing on post-COVID care? There's a post-COVID care center in Delhi now. But do you think that a long-term strategy perhaps needs to be devised to look into this?
Yes, I think so. And I think the government is also investing in this. Most hospitals are now starting a post-COVID clinic to follow up these patients. The government has also started what is a clinical registry for all COVID patients, which will also follow them up for 1 year to see for what post-COVID sequelae that we have. So that is a database and trying to see what is the percentage of sequelae. But management strategies, hospital-based, are also being developed. And I think this will have to be done not only in larger hospitals, but even in tier 2 hospitals and smaller areas, because COVID is now being seen across the country, even in smaller areas.
Yes.
And you will have to develop strategies for post-COVID care across the country.
You know, speaking of post-COVID care, Dr. Guleria, another viewer sent us a very interesting question on what tests should he be undertaking as a recovered COVID patient in order to know better the impact of COVID-19 on the body.
So some of them are based on your symptom profile: fatigue, not able to get up, feeling tired, body aches. Our concern is basically organ dysfunction. So one would say that you could do what we call a lung function to see your lung capacity. Is there a decrease in your lung capacity for your age? Because if that is there, there may be some scarring in the lung. You could get an echocardiography done to see that your heart functioning is all right. And you could get some simple tests that we do in terms of looking at your saturation, walking for some time, 6 minutes, and seeing whether there's a dip in your oxygen saturation, and routine blood tests. But I don't think anything else is required. But if you have any symptoms like fatigue, getting out of breath, or any other features, you must consult your doctor, and especially someone who is trained in managing post-COVID patients.
Right. Another very specific question coming in from a viewer who has no symptoms, no fever, cough, loss of smell or taste, all of that is fine. But the CT scan has still showed COVID patches in his lungs. Is it okay to get discharged from the hospital?
Yes, it's all right. As a matter of fact, this is something that was picked up in many studies. When they started doing in one study CT scans of asymptomatic patients who had no symptoms at all, they found that almost 30% of the people who had no symptoms, saturation was all right, had some patches on their X-ray, which was part of the COVID infection, and gradually it resolved on its own over the next few weeks.
Right.
So that is why one would say that if you're asymptomatic, your CT scan shows just a mild patch or small areas, your CT score is not high, it's not an issue to worry about, it's not an issue to start drugs straight away. Very often these patches will disappear on their own. The concern that we have is that in some individuals, they may leave a little bit of a residual scar.
Right. Let's talk about vaccines, Dr. Guleria. The big headline this week has been that Sinovac's vaccine has been approved for emergency use in China. Now, is emergency use of a COVID-19 vaccine safe?
So this is the biggest question, because there is a huge global debate on this in terms of the safety of a vaccine. So our concern is basically related to two factors. You may have a vaccine which may not be that effective. You may say a vaccine efficacy is something that we can compromise if we need to have a vaccine available immediately. But safety is something that you have to be very sure of. And safety is something that you need to monitor over a few months, because some vaccines can lead to side effects later on. And we know that some vaccine can lead to side effects which are infection related. So what happens is that if you have taken the vaccine and subsequently you get COVID, there are certain side effects which we know known as vaccine derived enhancement, which will lead to the infection becoming more severe, because of the antibodies the vaccine creates. It doesn't have sufficient neutralizing antibodies to neutralize the virus, and because that is not happening, it may sometimes lead to a more severe infection after the vaccination. So we need to see that the vaccine is safe, not only in terms of its side effects, but it doesn't lead to aggravation of the COVID infection once an individual gets it.
So you're essentially saying that the long-term effect of a vaccine is what one really needs to look at in order to better examine its efficacy. What do you then make of Russia's COVID-19 vaccine? There's a lot of international skepticism about the shots that have been, given, about the fact that, there's only been a study that's been done for 2 months on a few dozen people.
So that's the main thing. You see, there are again 2 or 3 issues. One is your sample size has to be large enough to pick up any severe side effects that may happen. If you do it in a very few number of patients or healthy individuals, you will miss that.
Right.
Secondly, there has to be sufficient duration to look for side effects. And also, like I said, side effects after someone has got exposed to COVID-19, so that doesn't get aggravated, because many vaccines do that. And the other issue is the efficacy of the vaccine in the high-risk population. We know that some vaccines don't work that effectively in the older age group, because sometimes when you give it to older people, their own immune status is weak, and the vaccine is not able to mount a good immunogenic response in the elderly because of what we call senescence, and therefore the vaccine is less effective. You have to then adjust the dose.
Right.
Sometimes in some studies they've given a double dose for the elderly to create an immune response. So when we're looking at the dosing of the vaccine and in different categories, whether it be the high risk group or whether it be people with comorbidities, you will need more data to make sure that in them it's safe and what is the exact dose.
Dr. Guleria, also, is it important to study data from different parts of the world, because genetic disposition is different and therefore the vaccine may react differently to people in different parts of the world?
To some extent, yes, we need to see for ethnic variation.
Right.
Also, there is this whole concern, which although is not really proved right now, that is there a little bit of variation or mutation in the virus in different areas?
Okay.
And therefore, will the efficacy of the vaccine vary from region to region?
All right. Before we end this broadcast, I have to ask you, do you believe that there's lockdown fatigue? Do you believe that there's a bit of a chalta hai attitude that has set in to the coronavirus, and are you worried about that?
I strongly believe that there is a lockdown fatigue and people have literally given up. And I feel that we have to reiterate what I've said in the beginning, that we are still in the thick of the pandemic.
Right.
And if we really need to get a handle on this, the initial message that we had of physical distancing, of wearing a mask, of washing your hands, not partying out, avoiding crowds is more important now than ever before. That's why the number of cases are increasing, because people have just sort of had enough lockdown fatigue. You go to the market, you'll see that there's such huge crowds, people are not bothered, people have their mask hanging down. And this attitude is actually driving the virus, because the virus thrives on such an attitude. So unless we are able to change this, the number of cases will continue to increase, and that is the main cause of concern.
Well, absolutely. I think one can't just sit back and hope that things will improve. You have to actively contribute to things improving on a daily basis. Thank you so much, Dr. Guleria, for sparing your valuable time. Thank you.